Waking up tired even after full night's sleep. Most people blame stress, busy schedule, getting older, but for 37 million Americans, this symptom is their kidneys failing. Study from National Kidney Foundation: 93% of people with early-stage kidney disease don't know they have it. They experience symptoms, but dismiss them as normal aging or stress. By the time symptoms become obvious, kidneys already lost 60 to 70% of function. At that point, damage is often irreversible. Research from American Journal of Kidney Diseases tracked patients from first symptom to diagnosis. Average time between first symptom and diagnosis: 4.3 years. 4 years of kidney damage that could have been prevented or slowed with early intervention. 7 specific warning signs that appear in early kidney disease. Signs doctors say you should never ignore past age 45. Signs that, when recognized early, can lead to interventions that preserve kidney function for decades. Today, all 7 signs. Why each one indicates kidney stress. When to see doctor immediately. And the simple tests that definitively show kidney function. If you're over 45, have diabetes, high blood pressure, or family history of kidney disease, these 7 signs could save your kidney function. Now, before we move on, a quick reminder. This video is for educational purposes only. It's not medical advice, and you should always discuss any health concerns with your doctor, especially symptoms that persist or worsen, as they may indicate serious conditions requiring immediate medical attention. And if you'd like a free kidney disease warning signs checklist, just comment the word signs below. You'll find the link waiting in the pinned comment. It's a simple 1-page guide showing all 7 signs, when to see a doctor, and what tests to request. Now, let's get specific. Here are the 7 warning signs of kidney disease you should never ignore. Warning sign number 1. Chronic fatigue despite adequate sleep. This is the most common early symptom. Study from Clinical Journal of the American Society of Nephrology found 82% of people with stage 1 or 2 kidney disease report persistent fatigue. Why does kidney disease cause fatigue? 2 primary mechanisms. First, waste buildup. Healthy kidneys filter toxins from blood. When kidneys struggle, waste products accumulate. These toxins make you feel exhausted, weak, unable to concentrate. Second, anemia. Kidneys produce hormone called erythropoietin that signals bone marrow to make red blood cells. Damaged kidneys produce less erythropoietin. Fewer red blood cells means less oxygen delivered to tissues. Result: fatigue. How to distinguish kidney-related fatigue from normal tiredness. Kidney fatigue persists despite good sleep. Doesn't improve with rest or vacation. Often worse in afternoon. Accompanied by difficulty concentrating or mental fog. Normal tiredness improves with adequate sleep and stress reduction. If you've been unusually tired for more than 2 weeks, despite sleeping well, especially if you're over 45 or have diabetes or high blood pressure, talk to your doctor about kidney function testing. Warning sign number 2, changes in how, when, or how often you urinate. Study from Kidney International. 68% of early-stage kidney disease cases detected through urine changes patients initially ignored. 4 specific changes to watch for. Change 1, foamy or bubbly urine that doesn't dissipate quickly. This indicates protein in urine. Healthy kidneys keep protein in blood. Damaged kidneys let protein leak into urine. Creates foam similar to egg whites. Change 2, increased nighttime urination. Needing to urinate 2 or more times nightly when you previously slept through. Indicates kidneys losing ability to concentrate urine overnight. Change 3, decreased urine output or difficulty urinating. May indicate kidneys not filtering enough blood or blockage developing. Change 4, blood in urine, visible or microscopic. Can make urine appear pink, red, or cola-colored. Always requires immediate medical evaluation. Important distinction: 1 instance of foamy urine after not drinking enough water is normal, but foam appearing consistently over several days warrants doctor visit. Similarly, occasional nighttime bathroom trip, normal. But sudden pattern change from 0 trips to 2 or 3 nightly needs evaluation. Warning sign number 3, swelling in ankles, feet, hands, or face. Medical term, edema. Occurs in 47% of people with stage 2 kidney disease. Why does kidney disease cause swelling? Healthy kidneys regulate fluid balance. Remove excess fluid and sodium through urine. Damaged kidneys can't remove fluid efficiently. Fluid accumulates in tissues, particularly in gravity-dependent areas like feet and ankles. Additionally, when kidneys leak protein into urine, blood protein levels drop. Low protein in blood allows fluid to leak from blood vessels into surrounding tissues. Kidney-related swelling has specific characteristics, appears gradually over days or weeks. Worse, at end of day or after prolonged standing. Creates indentation when you press finger into swollen area. Indentation remains for several seconds. Starts in feet and ankles, may progress to legs, hands, and face. Morning facial puffiness, especially around eyes, also indicates fluid retention. How this differs from other causes. Heart failure swelling tends to be more severe, accompanied by shortness of breath. Liver disease causes abdominal swelling first. Kidney disease typically affects lower extremities initially. If you notice persistent swelling that doesn't resolve overnight, especially with other symptoms on this list, kidney function testing warranted. Warning sign number 4, mental fog or difficulty concentrating. Research from American Journal of Kidney Diseases. 53% of early kidney disease patients report cognitive changes before diagnosis. Mechanism: waste products and toxins accumulating in bloodstream affect brain function, called uremic encephalopathy in advanced stages, but milder cognitive effects appear much earlier. Symptoms include difficulty focusing on tasks, memory problems, especially short-term memory, feeling mentally sluggish or confused, trouble making decisions, often dismissed as stress, aging, or lack of sleep, but when combined with fatigue and other kidney symptoms, indicates possible kidney involvement. One study tracked cognitive function in kidney disease patients, even mild kidney dysfunction, eGFR between 60 and 89, associated with measurable decline in executive function and processing speed. If you're experiencing brain fog that doesn't improve with better sleep or stress management, especially alongside other symptoms here, discuss with your doctor. Warning sign number 5, decreased appetite, nausea, or metallic taste in mouth. Study from Nutrients Journal. 38% of early kidney disease patients experience digestive changes. Why does this happen? Waste buildup creates compounds called uremic toxins. These toxins trigger nausea center in brain, create unpleasant taste in mouth, suppress appetite. Additionally, many people with kidney disease develop mild gastritis or stomach inflammation from toxin exposure. Specific symptoms: food doesn't taste right, especially meat. Metallic or ammonia-like taste, particularly in morning. Nausea without vomiting, worse in morning. Loss of interest in eating, unintentional weight loss. Important, many conditions cause these symptoms. Kidney disease, just one possibility. But when appetite loss accompanies fatigue, urination changes, and swelling, kidney function should be evaluated. Warning sign number 6, frequent muscle cramps, especially at night. Research from Clinical Kidney Journal. 41% of people with reduced kidney function experience electrolyte-related muscle cramps. Kidneys regulate electrolyte balance, including potassium, calcium, phosphorus, and magnesium. When kidney function declines, electrolytes become imbalanced. Low calcium or magnesium, high phosphorus, or fluctuating potassium all trigger muscle cramps. Most commonly affects calf muscles, feet, and hands. Often occurs at night, disrupting sleep. May be accompanied by muscle twitching or restless leg symptoms. Distinguishing kidney-related cramps occur frequently, multiple times per week, not related to exercise or dehydration. Don't improve with stretching or hydration. May be accompanied by muscle weakness. If you're experiencing unexplained frequent muscle cramps, especially with other kidney symptoms, Request comprehensive metabolic panel to check electrolyte levels and kidney function. Warning sign number 7, persistent itching without visible rash, called uremic pruritus, affects 29% of people with moderate kidney disease, increases to over 70% in advanced stages. Mechanism: waste products accumulating in blood get deposited in skin. Create itching sensation, often worse at night. Scratching provides little relief. Additionally, kidney disease causes phosphorus buildup. High phosphorus levels contribute to itching. Characteristics of kidney-related itching: affects large areas of body, not just one spot, no visible rash or skin condition. Worse after bathing or at night. Doesn't respond well to typical anti-itch creams, often dismissed as dry skin, especially in older adults. But dry skin responds to moisturizers. Kidney-related itching doesn't. If you have persistent widespread itching that moisturizers don't help, especially with other symptoms on this list, kidney evaluation appropriate. Let's recap the 7 warning signs of kidney disease. 1. Chronic fatigue despite adequate sleep. 82% of early cases experience this. 2. Changes in urination including foam, frequency, nighttime trips, or blood. 68% detected through urine changes. 3. Swelling in ankles, feet, hands, or face. 47% develop edema. 4. Difficulty concentrating or mental fog. 53% report cognitive changes. 5. Loss of appetite, nausea, or metallic taste. 38% experience digestive symptoms. 6. Frequent muscle cramps, especially at night. 41% have electrolyte-related cramping. 7. Persistent itching without rash. 29% in moderate stages, over 70% in advanced stages. When to see your doctor. If you have one symptom persisting more than 2 weeks, mention it at your next appointment. If you have 2 or more symptoms together, schedule appointment within 1 week. If you experience blood in urine, severe swelling, or difficulty urinating, seek medical attention same day. What tests to request? Basic metabolic panel measures creatinine and blood urea nitrogen, shows how well kidneys filtering waste. eGFR calculation, estimated glomerular filtration rate, tells you what percentage of kidney function you have. Normal is 90 or above. Urinalysis checks for protein, blood, or other abnormalities in urine. These 3 tests together give comprehensive picture of kidney health. Who should get tested even without symptoms? Anyone over 60. Anyone with diabetes or high blood pressure. Anyone with family history of kidney disease. Anyone taking medications that can affect kidneys. The critical point: kidney disease is progressive but manageable. Caught at stage 1 with 90% function remaining, lifestyle changes and medication can often prevent further progression. Caught at stage 4 with 30% function, options become limited. Early recognition changes everything. These 7 signs are your body's way of telling you kidneys need attention. Don't ignore them. Don't dismiss them as normal aging. Listen, report, get tested. Your kidneys work silently every day, filtering 50 gallons of blood, removing waste, balancing electrolytes. When they signal for help through these 7 signs, respond promptly. Remember, comment signs for your free kidney warning signs checklist with all symptoms and testing information. If this was helpful, tap like and share with anyone over 45 or anyone with diabetes or high blood pressure. Subscribe because next week we're covering the 5 foods that research shows can support kidney health and slow disease progression. Early detection, early intervention, preserved kidney function. That's the goal. These 7 signs help you get there.